Hello, my name is Sheena Wilton, and this poster presentation is titled Medical Cannabis in Oklahoma, Regulatory and Structural Barriers for Older Adults and Low-Income Patients. This project examines how Oklahoma's medical cannabis regulations shape real-world access to therapeutic cannabis, especially for older adults and lower-income patients, within the broader post-pandemic public health environment. The research question guiding this project is how does Oklahoma's post-pandemic medical cannabis regulatory environment influence equitable access to therapeutic cannabis for older adults and lower-income patients? To answer that question, this project used a policy and equity lens to analyze medical cannabis across barriers in Oklahoma. Sources included OMMA regulations and licensing data, housing and long-term care data, and peer-reviewed literature. The analysis focused on regulatory, economic, geographic, and institutional barriers that affect vulnerable patient populations. The central finding of this project is that Oklahoma expanded legal access to medical cannabis, but regulatory, housing, transportation, and market barriers still limit real-world access for older adults and lower-income patients. Several major access barriers emerged. These include physician registration and education requirements, application and documentation burden, the lack of direct delivery to patients, housing and institutional restrictions, transportation and mobility barriers, and out-of-pocket certification and product costs. These barriers matter because patients may be legally eligible for medical cannabis and still be unable to access it consistently in practice. Older adults and lower-income patients are especially vulnerable because they are more likely to face mobility limitations, fixed incomes, caregiving needs, and restrictions tied to housing or institutional settings. The poster also highlights important Oklahoma licensing trends. Between January 2020 and April 2026, Oklahoma saw a sharp drop in commercial licenses. Growers fell by about 61%, dispensaries by 37%, and processors by 53%. At the same time, patient licenses increased by about 32%, where caregiver licenses fell about 41%. These trends are important because they suggest that even while patient needs remain substantial, fewer caregivers and fewer commercial licenses may reduce support, affordability, and patient choice. In other words, legal access may remain broad on paper, while practical access becomes more difficult for some groups. The poster also includes Oklahoma access context. Research shows that about 42% of Oklahoma census tracts with at least one dispensary were rural, and dispensaries were more common in areas with higher proportions of uninsured residents. These patterns suggest that cannabis access in Oklahoma is closely tied to broader healthcare infrastructure gaps, especially in rural and underserved communities. Overall, the key findings are that commercial licenses declined sharply, older adults in long-term care faced added barriers related to mobility and facility policy, and no direct delivery, plus physician certification requirements, increased logistical burden for vulnerable patients. The policy implications are clear. Improving equitable access may require stronger patient navigation and caregiver support, reassessment of delivery restrictions for medically vulnerable patients, expanded clinician education on therapeutic cannabis, and continued monitoring of affordability as the market contracts. In conclusion, Oklahoma expanded legal access to medical cannabis, but real-world access remains uneven for older adults and lower-income patients. This project shows that public health access depends not only on legalization, but also on affordability, transportation, housing, caregiver support, and regulatory design. Thank you for your time.